Good day to each and every one of us. So we are the group 4 and this is our recorded discussion about BHI or Baptist Hospital Incorporation. I am Florence Sarah Alexis and I'll be the one to give you knowledge about the brief history of BHI. So BHI has created a culture that is spirited in quality and service excellence. The First Baptist Church initiated the effort to secure widespread community support and open Baptist Hospital. So in 1951, Baptist Hospital was known as a community-owned hospital based on Christian values. Also in 1951, their main hospital building was originally composed. In 1985, GBH has opened. GBH is a relatively new facility and has fully equipped intensive care unit. In 1995, after recognizing a trend of less than desirable results in patient and employee satisfaction, BHI began their journey to the new mission statement for BHC. In 1997, BHI created a corporate compliance department to provide oversight and coordination of state and federal laws. In 1998, senior leaders adopted the MVVP. So BHI's senior officer evaluate the MVVP during steps 1 to 3 of their strategic planning process to ensure that they continue to guide and inspire the work of their organization. In 2000, this was the year when BHI opened BMP. Also, this is the year when BHI's net revenue or bad debts and days outstanding in accounts receivable were trending in a negative manner. Also, lastly, in 2003, their board of directors created an audit subcommittee of the Finance Committee in response to growing concerns about national corporate responsibilities. So this is the brief history of BHI. So let's now go to the next.
I'm Christine May Flores and I will report about the Consumer Assessment of Healthcare Providers and Systems, which is the previous process of Baptist Hospital Incorporation. The CAP surveys and the potential financial impact of value-based purchasing have elevated the patient experience to one of the most pressing issues currently facing by healthcare organizations. For hospital and health systems, CMS requires the submission of data for a series of quality measures, which include the HCOPS or Hospital Consumer Assessment of Healthcare Providers and Systems Survey that are then used to impact the amount of reimbursement, which also include financial penalties for underperformance. Since HCOPS surveys solicits feedback from patients regarding their stay in a hospital, efforts by caregivers to ensure that patients' experiences are positive have taken on added importance. So to support hospital in improving their patients' experiences, HealthStream has developed a unique approach with its Patients Experience solution that focuses on improving the skills and competencies of workers as well as providing insightful analytics from its deep database of healthcare organizations across the industry. HealthStream delivers innovative benchmarking reports and corresponding mobile applications that organizations can use to compare their patients' feedback relative to others, to further assist healthcare organizations in understanding how to improve their patients' experiences. HealthStream offers innovative training curriculum and courseware for hospital employees.
Good day everyone, I'm Chara Chastin Argalimba and today I will be discussing the implementation of some tools and techniques used for performance excellence at Baptist Hospital. The first technique is using the 5 pillars of operational excellence, which are the people, service, quality, financial, and growth. So the first one is the people. They look ahead that they should be the employer choice in the market area and the healthcare industry leader in values-based recruitment, employee satisfaction, employer retention, and leadership development. It means that they ensure the satisfaction of the organization's skilled employees and to take the appropriate steps to retain them, while also balancing the resource requirements of the customer segments. They also prioritize developing Baptist hospital leaders, thus they continue to be innovative on its leadership development program. The next one is the service. Baptist Hospital is working on to provide world-class service to all of its customer types. It means that they provide compassionate care and service to all customers at a level which continues to set the highest standards in healthcare industry. Each year, they sustain the organization position as industry leader in patient satisfaction. Baptist Hospital is committed to sharing its knowledge with other healthcare providers. They continue to move beyond high customer satisfaction to customer loyalty. The third one is the quality. They ensure that they achieve healthcare industry leading results in clinical performance. They sustain significant improvements in their clinical processes. They also focus on patient safety issues to assure quality. They also conduct hospitalist program that is a strategy for clinical improvement. They provide uniform measurement tool with established targets to assist in improved clinical quality. The second to the last one is the financial. Baptist Hospital optimizes financial results while meeting its mission to provide services to all regardless of ability to pay and to improve health status and quality of life for residents of communities served. They continue to focus on reducing costs and improving revenue. And lastly, the growth. Baptist Hospital achieves responsible growth in volume and service locations while achieving financial targets. The organization is committed to meeting the ever-expanding health services access and needs of the downtown area population and seeks to secure financial resources to do so by expanding their services in the population growth areas. They plan for the future wherein they acquire additional inpatient beds, extensive expansion of operating rooms and emergency department. They see to it that there must be tangible growth and improvements in their hospital. And the other tool or technique they are utilizing is the flat, fluid, and open leadership system based on communication. Under this system, staff are not just encouraged, but they are expected to involve and contact anyone in the organization, including the president, at any time to discuss work issues and improvement opportunities. To reinforce this, the president established an open door office that has a large window facing the busiest part of the hospital. Senior leaders also serve as role models and are personally engaged in creating a no secrets environment through activities such as the daily lineup, in which all the leaders and employees gather at each shift to review information at Baptist Daily, and quarterly around the clock employee forums. They are also accountable for organizational performance through a no excuses policy. This implies that they inculcate or instill a culture wherein everyone has to take responsibility of their respective works.
Good day. I am Bernardine Franche Galvez and this is my report. Today we will tackle my report regarding the implementation for tools and techniques used in BHI. First, the values. These values help BHI to clearly define and use to recruit, orient, and train employees to reinforce the culture of excellence and to guide their decision making. First, the integrity, where they maintain the highest standards of behavior encompassing honesty, ethics, and doing the right things for the right reasons. Second, the vision. It shows their ability and willingness to look forward to the future and make decisions necessary to accomplish important goals. Third, the innovation. It shows that they are capable of extraordinary creativity and willing to explore new approaches to improving quality of life for all persons. Fourth, superior service. It shows their commitment to provide excellent service and compassionate care. Fifth, stewardship. They are dedicated to responsible stewardship of the organization's assets and resources and to community service. And lastly, teamwork, where they abide respect for others and sustain commitment to work together. The performance improvement system. The BHI leadership, by their own actions, make improvement and learning parts of the soul of the organization. In that way, they can improve their performance excellence. First, BHI uses the planning function, which ties the departmental 90-day action plans to annual and longer-term organizational goals and objectives. Second, the employee satisfaction, trust, and empowerment in a non-punitive environment. Third, rapid return patient satisfaction findings and teams. Fourth, the use of evidence-based clinical improvement or EBCI methodology and care reports for improving healthcare performance outcomes and reducing variations. Fifth, BHI uses culture of open communication and additional learning and sharing through Baptist traditions, Serve-You program, employee forums, daily lineup, and Baptist University. And lastly, BHI uses the Baldrige criteria and feedback reports as a platform for continued improvement.
I'm Florence Espero, and I will be discussing about the result of the application of tools and techniques. The commitment to service excellence has resulted in BHI leading the industry to patient and employee satisfaction. For the second consecutive year, BHI continues to define and achieve role model customer satisfaction for all customer groups. The role model employee satisfaction are an emphasis on employee empowerment and sense of ownership along with the culture of open communication and continuing education. A large investment was made in leadership and development by presenting quarterly educational sessions for managers and supervisors. Next, the hospital initiated service teams comprised of employees from throughout the hospital to advance communication, patient satisfaction, measurement, service recovery, reward and recognition, and service standards. Managers and supervisors learned how to identify high, middle, and low performing employees and how to have crucial conversation to ensure a more dedicated and effective workforce. Baptist Hospital held employee forums, implemented nurse rounding and senior management rounding, as well as established report card and 90-day plans to increase management accountability. In the area of rewards and recognition, more than 30,000 handwritten notes, thank you notes, have been sent to staff to acknowledge outstanding acts of service and operational excellence. Implementing student principles and tools coupled with the dedication of Baptist Hospital leaders and staff engagement have led to the following successes. First, the service. Baptist Hospital was ranked among the highest in the nation by its medical staff with an overall satisfaction score in the 94th percentile, as measured by the National Independent Research Company. By employing a hospitalist group and setting clear performance goals for these physicians based on the student service model, Baptist Hospital was able to raise patient satisfaction with hospitalists to the top 5% in the nation. Second, the quality. Performance in the national quality measures improved significantly with the preliminary data showing that 88% of the 28 measures had reached the top 10th percentile by the close of 2007.
The hospital heart attack unit continues to save lives and heart muscle by maintaining a percutaneous coronary intervention or the PCI for heart attack patients. Baptist Hospital was the only hospital in Florida to be visited by the Institute for Healthcare Improvement or IHI. Baptist Hospital was the only Miami hospital selected for a National Consumer Choice Award for having the best overall quality and image. Baptist Hospital was recognized by Health Grades as one of the America's 50 best hospitals based on its annual study of hospital quality. Other Health Grades awards for the Baptist Hospital in 2007 include Distinguished Hospital Award for Clinical Excellence, General Surgery Excellence Award, Maternity Care Excellence Award, Pulmonary Care Excellence Award, Stroke Care Excellence Award, Vascular Care Excellence Award, and Women's Health Excellence Award. Third, defendants. The hospital operated significantly better than budget throughout 2007 by reducing the number of patients in the emergency center that left without being seen. The hospital achieved an additional $1 million in patient revenue. Fourth, people. Baptist Health was listed as a top employer on the Fortune 100 Best Companies to Work For list published in the February issue of Fortune magazine. Baptist, which ranked 94th, is the only Florida-based healthcare organization to be recognized as a great employer. Through thank you notes, increased rounding, and leadership development, Baptist Hospital was able to reduce employee turnover as well as the employee vacancy and nursing vacancy rate in 2007. And lastly, growth. The construction of the new emergency center and bed tower was opened last 2008. The Baptist Hospital Emergency Center will be the largest in terms of square footage in the States. And that's all. Thank you for listening.